Ready. Okay. So we'll start off by doing our pre-procedure steps. And after that, we'll go ahead and get started with the assessment. So I will first start off with the nails and the hands, checking the skin integrity of the arms, making sure that it's warm to touch, the skin is dry and smooth, there's no lesions or visible masses or any erythema. And I will check the nails, make sure that there is a prompt cap refill about less than 3 seconds. Make sure there's no clubbing, have them touch nails for the diamond test. That there's no clubbing or concavity and no brittleness, and that the nail bed is pink and the nail is translucent. Next, we'll go ahead and move on to the hair, head, and face. So the hair is evenly distributed for the age, and texture is fine. Yes, the texture is fine. The next we go into the head. Head is normal cephalic. No noticeable masses or any tenderness. No tenderness in the maxillary or frontal sinuses. We will move into the face. I would have them do various facial movements, like smile, frown, check their facial symmetry, and check for any involuntary movements or tics. So with that, we would confirm the facial nerve is intact. Then next we would go into still with the face, make sure that there's no noticeable lesions or erythema or ecchymosis. And then afterwards, we get into the eye. We'll get into the eye and do, first I would just do test their visual acuity with like a Snellen chart, or have them look ahead and close one eye at a time. Say like how many fingers am I holding up? Do that one eye at a time. Then next we would do the 6 cardinal gazes. Go up, side, down, side, up. And then we'll go ahead and check our perla. Come in. And the pupils are equal, round, reactive to light, and accommodate. So we have confirmed that the optic nerve is intact, oculomotor, trochlear, and abducens nerve is intact. Next, we move into the mouth. I would have them say ah. Check the lips, make sure that they're not dry or cracked, or any bleeding or any fissures in the corner of the mouth. Then as they say ah, make sure that the uvula rises midline. I would then take like a tongue depressor and assess their gag reflex, make sure that their vagus nerve is intact, and have them stick their tongue out, protrude it, and then put it back in, then say like might, tight, light. Make sure that there's no tremor of the tongue. And then with that, we would confirm hypoglossal nerve is intact. We'd also confirm that the glossopharyngeal was intact with the uvula rising. The next we would go into, still with the mouth, we also notice that the mucosa is pink and the gingivae is pink and moist. The teeth are in good repair, and the tongue is midline. Next we would go into just the neck. So upon inspection, there is no visible damage to the skin integrity, no masses or lymphadenopathy. Check all the lymph nodes, the postauricular, preauricular, occipital, the posterior chain, the superficial chain, and then the deep cervical chain, or superficial cervical chain, and then deep cervical chain. Also get the jugulo-digastric lymph nodes, submandibular and submental. Next, make sure that the trachea is midline and that it is supple. There is a non-palpable thyroid. Make sure that they can swallow and that there is no external jugular veins. So then next we'll go ahead and get into the chest. I'll go ahead and we'll go ahead and do the heart sounds. We'll go ahead and do the heart sounds, and then so first I will listen to the aortic position, and then the pulmonic position, Erb's point, tricuspid valve, and the mitral valve. Make sure that S1 and S2 are intact. I would note the rate and rhythm, and Make sure that there is no visible heave or thrill at the apical impulse. There is no murmurs, extra sounds, diminished sounds, or accentuated sounds. Then next we can go ahead and we can do breath sounds. I'll listen to my 5 spots in the breath sound, getting the upper right quad, or the right upper lobe, then the left upper lobe, still the left upper lobe, then still the right upper lobe, then right middle lobe, still left upper lobe, then left lower lobe, and then right lower lobe. So after that, then I would also check on the back, my 9 posterior breath sounds, make sure that there's no adventitious sounds, breath sounds are clear. Then we can go ahead and inspect the chest, make sure that there's no damage to the skin integrity, make sure that the AP diameter is greater than, AP diameter is less than transverse diameter. There's symmetrical chest expansion. Tactile firmness or tactile firmness is equal bilaterally. Have them say like 99, 99, 99. Then next we would, you can palpate over the lung fields and you'll be listening for resonance to percussion. Then, and then we can also palpate the chest for any tenderness. Next we move into the abdomen. Go ahead and inspect the abdomen first, make sure that it's flat, symmetrical, flat and symmetrical, and that there's no visible masses, no damage to the skin integrity as we check the abdomen. Then we go ahead and auscultate first so we don't stimulate peristalsis. So start in the right lower quadrant, listen for a minute, and then right upper quadrant, then left upper, then left lower. Listening for normal active bowel sounds. If we don't have any bowel sounds, we'll listen to that quadrant over for about 5 minutes until we hear something. Then we will go ahead and percuss in 2 spots in each quadrant, starting the right lower, right upper. Listening for tympani tube percussion. Then after we would go ahead and palpate. Oh, don't forget to percuss for the CVA tenderness. We'd have them stand up and just palpate where the kidney would be. Then we would, or not palpate, percuss. Then we will palpate the abdomen, right lower, right upper, left upper, left lower. And then go ahead and move into, I skipped my carotid pulses at the top. I'll make sure that my carotid pulses are 2+ and equal bilaterally. So then after that, we'll go ahead and get our arms or upper extremities. Make sure that there's no damage to skin integrity, no erythema or ecchymosis or masses, that they are symmetrical, there's no noticeable atrophy. Then we'll go ahead and test their full range of motion. Have them abduct the arm, then circumduct, then have them, then we'll test the strength on the shoulders, then adduct back, and we'll do that bilaterally. Then we'll check at the elbow, have them flex, have them extend, have them supinate, pronate, and then I'll just have them stabilize and don't let me move, test the strength, and then see their wrist flexion, wrist extension, circumduction, and then inversion, eversion, supination, pronation. Then next, so there's no crepiness or any pain in the joints. Then I'll go ahead and check the pulses, check the brachial pulses, make sure they're 2+ and equal bilaterally. Then the radial pulses, 2+ and equal bilaterally. Okay, so then after that, then I'll go ahead and move into the lower extremities, make sure there's no varicose veins, or the hair is evenly distributed, and there's no visible lymphadenopathy, no masses or lesions. I'll check the warmth of the skin, make sure that it's warm to touch, smooth and dry, and do that for the feet as well. Then we can go ahead and test for posterior tibialis pulses. So get those 2+ equal bilaterally, and then dorsal pedis pulses, 2+ and equal bilaterally. Then we'll test strength and range of motion in the hips, knees, and ankles. Have them abduct, circumduct. Then test their strength. And then have them pick up the leg, flex the knee, extend the knee. You can also external rotate the hip and internal rotate the hip. Then plantar flex and dorsiflex at the ankle. And then just don't let me push it down, don't let me push it up. So then after that, we've already made sure that the full range of motion is smooth and there's no crepiness or tenderness in the joints. Then we'll go ahead and do neuro. Check with vibration, light touch, and like a pinprick in certain places in the arms, face, legs, and feet. Okay. And then after that, we'll go ahead check. Also, I didn't check their spinal accessory nerve up here at the neck. So I just basically apply pressure to their shoulders and have them shoulder shrug. So the spinal accessory nerve is intact. I skipped her nose. We're also going to check her nose, make sure that her nose is proportionate, and her ears. I'm going to check her nose, make sure it is proportionate and symmetrical. There's no visible lesions or deformities. Check inside the nares. Make sure that the nasal mucosa is pink. There's no visible damage to the integrity. No septal deviation or edema or discharge. Then we'll go ahead and take our nasal speculum and then check inside the nose. Make sure that, we had already checked it with the nasal speculum. Then we'll take our alcohol pad, have them close their eyes, close one nostril, smell, and then smell the other one, making sure that the olfactory nerve is intact and theirs are patent. Then we would go ahead and get into the ears. Make sure that the ears are symmetrical, proportionate. There's no pain, no discharge. Then look inside, check the tympanic membranes and make sure both are pearly gray, landmarks are intact, and light reflexes are intact. Then we would do our acoustic, test for the acoustic nerve, and do a whisper test bilaterally. Make sure that they can hear bilaterally, the acoustic nerve intact. Then then back to the neurologic. Test their deep tendon reflexes. Make sure they're 2+ and equal bilaterally. In the bicep tendon, tricep tendon, patellar tendon, Achilles tendon, and the brachioradialis. Also, you want to make sure and check the drains that there's no occlusion, there's no kinks. Check the color, check the odor. Then we can check Stravinsky, make sure that that's negative. Check the musculoskeletal. We'll have them stand up. We'll have them stand up and walk across the room. Make sure that their gait is smooth and balanced, and then have them tandem walk. Heel-to-toe fashion, and make sure that the gait's smooth. And once again, then do a Romberg sign test. Make sure that there's no loss to proprioception, so we already changed, checked full range of motion and strength, and then genital urinary, asked when the last urinary production was, the last bowel movement, the color, odor, the amount, and then we would check any wounds if there is any available or any noticeable. So, and then do my post-procedure steps, and that's it.